Hi, I'm Jim Harrison of the Vermont Grocers Association. As you no doubt know from our weekly reports and almost daily news accounts, the healthcare reform legislation is no doubt the biggest issue of the 2011 Vermont legislature. In the coming weeks, several Senate committees will be voting on the House-passed bill. Irrespective whether you agree with the approach being taken or have strong concerns about it, I encourage you to communicate with your state senators this week. It is only with your input can they make a better decisions on this bill. What does the bill do? As passed by the House, House Bill H202 has three major components. Green Mountain Care Board to control health care cost growth. It establishes the Vermont Health Benefit Exchange, and it puts us on the path for putting in place Green Mountain Care, which is to provide universal access and hopefully maximize cost savings. First, the Green Mountain Care Board will be responsible for Vermont's healthcare system, similar to the Public Service Board for utilities. It will be independent from executive and legislative branches. It will consist of 5 members nominated by a new Green Mountain Care nominating committee and appointed by the governor with the consent of the Senate. It will oversee and evaluate payment reform on all levels, primary care, specialty care, hospital care, aimed at moving from payment for volume to payment for value. Develops overall healthcare budgeting, provides strategic planning for Vermont's healthcare system through comprehensive data systems, adequate staffing, etc. And it will design the health plan benefit plans and recommend ways to finance, likely a payroll tax as a major component. Second thing it does is establishes the Vermont Health Benefit Exchange. This is often be referred to as like a portal where you can buy different insurances. It consolidates purchasing and simplifies purchasing of health insurance. Creates easy to access website for health insurance, one-stop shopping, provides access to federal health insurance subsidies for those that qualify. Initially will be for all individuals and employers up to either 50 or 100 employees. It envisions one insurance carrier offering 2 deductible choices plus 2 federal options. Green Mountain Care, the third part. Implementation is not likely before 2015. This is a universal health care program providing health care for all Vermont residents, including providing them with access to primary care, preventive care, chronic care, acute care, and hospital services. It occurs after the Affordable Care Act waiver is attained and financing plan and budget are enacted into law. All Vermonters would be covered by virtue of their residency with penalties of falsifying that. The GMC board proposes a 3-year budget that must be approved by the legislature. Financing must maximize federal funds and spread costs fairly. The integration and financing plans will address such things as what will the overall costs and savings be, how much federal dollars will we get, how do we deal with border issues, how are public and private coverages integrated, what will we all pay. That concludes the basic summary of the legislation today. There is a lot of anxiety by many members of the business community over how much this will cost. Will it supersede plans they are now offering if they have self-insured ERISA plans? And increasingly by medical professions over what will happen to reimbursement rates if lower than surrounding states. Will it lead to shortages of certain specialists? While there is a widespread agreement that the current system is too expensive and needs reform, it is clear that a consensus has not yet been reached among many segments of Vermont. Thank you for listening. Again, this is a crucial week, and we encourage you to be in contact with your senators and tell them what you like as well as what you don't like, and please ask questions on those areas that you need more clarification. Thank you for listening. Good day.